Okay, part 5, we're going to be talking about Parkinsonism symptoms. So not saying that you have Parkinson's disease, but we want to talk about what do those symptoms look like before you're actually diagnosed. We're also going to be talking about leaky gut and constipation. So what we're really going to be diving into here is this right in here out of the 3 most common neurodegenerative diseases. So Parkinsonism. So what you're going to know is stiffness, slow motions. This is very, very, very critical. Decreased smell. When was the last time that you had a good meal, right? If you can't remember the last time that you had a good meal, that tells you that your smell is going. Now, in early Parkinsonism symptoms, you're going to have a decreased smell along with decreased motility. So, GI problems. In other words, you should be making a bowel movement every 2 to 3 times per day. All right, so let me say that again. You should be making a bowel movement every 2 to 3 times per day. You should have no gas, no bloating, no constipation, no diarrhea. You shouldn't have to take any like heartburn medications. If you are, that's telling you that your GI system is not working right, and this is an indicator of early Parkinsonism. So what I've found clinically is I'll ask people, when's the last time you had a good meal? Or can you really taste food? And people say, no, I can't taste food. I can't remember the last time I had a good meal. And then I'll ask, well, how often do you make a bowel movement? And they'll say every other day, every third day. So these are all warning signs that your body's not functioning right. And these are indications of early Parkinsonisms. Resting tremor, that's another sign. So this is just basically a form that I use that kind of tells you what's happening if you have early signs of Parkinsonism diseases. So you have slow movements, cramping hands when you write, your voice becomes softer, your face is kind of just a masked face, they would call it here. When you walk, you feel like your head's starting to move forward, because when people have early signs of Parkinsonisms, they start to move forward because their center of gravity is pushed like back. So if your center of gravity is pushed back, you're going to have a tendency to want to move forward. Your writing gets smaller, so as you write here, this is going to be a demonstration, as you write here, it's big, and then as you start to finish, it gets really small. So this would be your writing. It starts to get small right there. Impaired bowel signs, loss of smell, and just feeling like you're kind of just like really kind of stiff. So these are all the things that we can do clinically to help support your body to recover and gain momentum. So this comes from the Parkinson's Foundation. These are the 10 early warning signs of Parkinson's disease. It says, here's the thing. When you're diagnosed with Parkinson's disease, that disease has been there for a long time. So what we want to do is the real purpose of this is try to find these early indications so that we can stop that and we can reverse these degenerative diseases. So this comes from the Parkinson's Foundation, the National Parkinson's Foundation. So these are the first early, this is the key thing, early, right? Because we want to get things early, not late. Shaking hands, loss of smell, trouble walking, movement, small handwriting, trouble sleeping, constipation, right? You got to be making 2 to 3 bowel movements every single day. It's illegal, right, to be constipated. You cannot be constipated. Lower voice, dizziness, fainting, masked face, and being hunched over. These are the 10 early signs of Parkinson's disease. Now, here we have the early signs, we have progressed signs, and this is where you're actually diagnosed. This is when you have the resting tremors, you're really rigid, you have dementia. So let's just go over here. So why is the loss of smell? So the things that we really want to focus on is loss of smell, constipation, being depressed, postural things, fatigue, and sleep problems. Now, what happens here when it comes to constipation is I want to show you this diagram right here. What the current medical research is showing is this is your digestive system right in here, right? This is all your small intestine. Then there's this nerve here. Let me just change my pen here. There's this nerve here that comes down here. This is called your vagus nerve. So what they have found is that if you have constipation problems, that there's actually this thing called alpha-synuclein that can get in the nerves and travel up your vagus nerve into your brain. Okay, so this is why you cannot be constipated, because things are traveling up your nervous system and have direct access to your brain. So you cannot be constipated. You have to make regular bowel movements. So if your bowel movements are not moving, that is a major problem. And now, same thing here. This kind of goes over your brain right here. So this would be like the first stages of Parkinson's signs or symptoms. Is the first thing right here is your vagus nerve, right? Your vagus nerve. This is the diagram right here. So the vagus nerve goes all the way up to here, to this part of your brain, which is called your cerebellum. So one, if you're constipated. Then the second thing here, you can see this right here. It says your olfactory bulb. So in the early signs, it affects two things. Your smell. Okay, so I've done these tests on patients. I have these things in my office. This is peppermint, and it's anise, or really it's like licorice. It smells like anise is licorice. So I have people smell these things, and people cannot smell those things. Like, I'll put this up to their nose, I'll cover one nostril, I have them close your eyes, I'll say, do you smell anything? Take a big, nice whiff in. They'll take like 3 or 4 big whiffs in, and they won't smell it. Or they'll take 3 or 4 whiffs in, and they'll guess, is that peppermint? Same thing with the licorice. They'll say, is that licorice? After 3 or 4 smells. That's not instant, because the early signs here, the early signs when it comes to Parkinsonism is it affects the vagus nerve, which comes right in here. This is your vagus nerve, and then your olfactory. Then as it progresses, you can see here olfactory is smell. Then as it progresses, then you start to get sleep problems. And then here, when it really starts to progress, you start to get dementia symptoms because it's affecting your whole entire brain. And down in here, you can see this here is what your brainstem is. That's where your vagus nerve goes right into, is right in here is your brainstem. So it's illegal to be constipation. Here's the studies that show this. There's diagnostic value in people that have olfactory, which is smell, decreased smell, in Parkinson's disease. The 3 odors that demonstrate the best sensitivity in contrast between healthy people and people that have Parkinson's disease are coffee, which is 1, 2, peppermint, and 3, which is this anise, or which is basically licorice smelling. So again, if you can't remember the last time you had a good meal, or if you have constipation, those are warning signs that it's not working right. Here's another research from the article Brain. It says severe olfactory dysfunction is a prodromal, which basically means early onset of a disease of Parkinson's and dementia. So not only is poor smell an indicator of possible future Parkinsonisms in the future, it's also possible, it's also linked to dementia as well. So if you have poor smell, you can have early signs of Parkinsonisms and early signs of dementia. I'm just going to kind of summarize this right here. Our findings suggest that the brain region related to olfactory smell are closely related to cognitive decline. Okay, we're talking about memory. So brain function, these are warning signs that something's not working right. Cognitive decline and severe, which is this right here, this means poor smell, is a prominent clinical feature that predicts subsequent development of Parkinson's disease and dementia. So we got to get your digestive system working. Poor smell dysfunction is an early preclinical signs of Parkinson's disease. Again, this is all, it's not Dr. Hugh's opinion. This is medical fact. This comes from that journal there. Now, people say, well, how does this stuff from your digestive system travel up your vagus nerve? Well, if you ever had shingles, right? So this is shingles right here. I've had shingles, right? Shingles right here. Shingles is a very, very painful disease. Now, if you know anything about shingles, what happens? It travels, the virus here travels in your nerves. This is a nerve right here, and then it goes to the skin, and it causes these blisters. That was the worst pain of my life. I actually thought that I had a herniated disc in my mid-back, and it turned out to be shingles, and I broke out. It came around around to my front. It was just really, really bad. So here what we have is we have normal, then we have Parkinson's disease. So here we have increased disturbance problems, decreased motility, such as constipation, increased pain. And what that causes dysbiosis, which is basically bad bacteria. They travel up your vagus nerve right here and into your brain, so they get access to your brain. Then what happens here? Then your brain's on fire. You get pain, depression, anxiety, behavioral changes. Versus normal, like these bad guys don't travel up to your brainstem if you have normal, healthy digestive system. Here's just another indication here. It says these findings, when it comes to the vagus nerve, that's vagus. That just means vagus nerve. Okay. These findings say that researchers suggest that having an intact vagus nerve increases the risk of developing Parkinson's disease. The finding is in accord with the primary pathological process being initiated in the GI system, which then uses the vagus nerves as a major entry point into the brain. Okay, so there is tons and tons of research out there that's saying that if you're constipated, these bad guys here, this is the bad guys, travel up your vagus nerve into your brain, right? And then they start attacking your brain, and then your brain is on fire. Okay, when your brain's on fire, guess what you start to have? Neurological degenerative conditions. Here's another research study. You can see 2015. In this review, we present clinical and pathological evidence to support the hypothesis that Parkinson's disease starts in what? The gut. Okay, it starts in the gut, and then it spreads to your brain, in particular, the substantia nigra. That's where dopamine is made. So we got to get your digestive system working right. You got to be concerned about your GI system. Now, this is a really, really important picture here. Is right here we have two different things. We have your gut. When I say your gut, your small intestine. Your small intestine is roughly 36 feet long. Now, right here, this would be your food right here. This is the food. This is the other side of your digestive system. So this is your, right here, this is your digestive tract right here. Now, here's what happens is your digestive system here is one cell thick from, this would be the outside, right? So this is where your food is. It's one cell thick from the outside to the inside. Now, what starts to happen is if you have poor digestive system here, see these cells down in here? They actually start to break and deteriorate. So what happens is then these bad guys can get into your nerves right here and travel up what nerve? Up your vagus to your brain. So your gut barrier is only one cell thick. Okay, it's only one cell thick. Now, if you cut your finger, you literally have to go through like 10,000 skin cells before you get in the blood. Your skin is a very good barrier. Your digestive system, your small intestine, is a very poor barrier. So you can see how these bad guys get in your nerves and start infiltrating your nerves and go right up to your brain. Now here the thing is now we're talking about your brain here. See, we're talking about your brain. Here we're talking about your gut. This is a little diagram right there. So here, this is just a picture. You can see how it's spread out right here, and then it's spread out right here in your brain. Now, the blood, this is your blood right here, and the inside of your brain, this would be your brain, your nervous system tissue right here, your brain right here. How many cells thick is that? That's what? One cell thick. So guess what happens to these cells? They start to break down. When they start to break down, guess what can happen? Even more bad guys can get into your brain and cause inflammation. See, your brain doesn't have any pain fibers. So it doesn't say, ow, my brain hurts. What happens is you have all these symptoms. You have fatigue, poor concentration, poor memory. You're forgetting things. Your brain fatigues out. These are all indicating, these are all things that indicate your brain's not functioning well. It's only a one cell barrier between your blood and your brain. So if you feel that you're chronically inflamed, guess what? Your brain is going to be chronically inflamed. Here's another test that I do. This is a food sensitivity testing. So you see this is 0 and this is 6. The higher this graph, the more sensitive someone is to the food, meaning the more inflammation that's going to cause, the more gut breakdown that's going to cause, the more probability that's going to create that these bad bacteria are going to climb up your vagus nerve into your brain. So you could be eating, for example, eggs 3-4 times a day, and what's happening to your body? Your body's inflamed. If your body's inflamed, things don't start to work right. You get distension. Your stomach starts to get big. All these things are problems that need to be looked at. Now, when you have this, this is going to cause leaky gut. Now, what's leaky gut? Let's just go back to this. This right here is leaky gut. Okay, this is leaky gut right here, where these cells start to deteriorate and break away, and then bad things can get into your nerves and move up into your brain. Now, then the thing is, well, what causes leaky gut? Well, right here, food sensitivities will cause leaky gut. What else causes leaky gut? Mechanisms of leaky gut. So, alcohol, this is gluten. It's a protein in wheat, milk, processed foods, excess sugar, fast foods, antibiotics. Guess what? Antacids. So if you have heartburn and you're taking these Prilosec, these purple pills, that's causing leaky gut. You have yeast overgrowth, hormones that aren't right. You can have poor thyroid. You can have poor hormones. Women don't have enough estrogen. This is why a lot of these brain degeneration things start for women in postmenopause. Why? Because all your female hormones are gone. Same thing with men. Testosterone. Intestinal inflammation, autoimmune conditions. So there's a lot of things that can actually be affecting your digestive system, causing your brain to be inflamed. Here's another research article right here. Constipation is a common problem in Parkinson's disease, occurring in about 50% of patients and may occur even before motor, which means like you get really stiff, symptoms appear. So this is a huge indicator that things aren't working right. Here's another study. Sleep disturbances, fragmented sleep, poor sleep, restless leg, nightmares, rapid eye movements. These are all early signs. Here's the thing. Early signs of Parkinson's disease, so we can actually get in it, stop it, and turn that around and get your body functioning better. They've also done some research on people that have inflammatory bowel disease. And what they found is that people that have inflammatory bowel disease, that it's just not in the digestive system. It actually causes white matter lesions. Well, what are white matter lesions in your brain? That's actually when your brain starts to degenerate. So if you have Crohn's disease, not only is it a digestive problem, it's a brain problem, and it causes your brain to start to degenerate. Ulcerative colitis has traditionally, now we're talking about functional medicine, right? So this is the leading edge. Has traditionally been considered an inflammatory disease, only related to the digestive system. However, since it has been shown that ulcerative colitis is frequently accompanied by various extraintestinal disorders, there's increasing evidence that ulcerative colitis may also manifest in the nervous system. Okay, so it actually climbs in your nervous system. Here's this white matter. You see this white matter right here? It's the brain starting to degenerate. Demyelination of the brain in someone who has Crohn's disease. So these things travel up the vagus nerve. Here's just another visual. This is your brain. This is your digestive system. And you can see how your vagus nerve goes right up into your, basically, right up into your cerebellum right here and starts affecting those different receptors in there. So if you have a digestive problem, they call it SIBO, small bacterial overgrowth. If you are not making 2 to 3 bowel movements every single day, this is what's happening in your body right this second. So I'm just going to summarize what's happening. So if you're not making 2 or 3 bowel movements a day, you have bacteria that starts to overgrow. Why do you have bacteria that starts to overgrow? Because your food sits in your small intestine and starts to ferment. Okay, when it starts to ferment, it starts to rot. And when it starts to rot, these are all the things that can happen here. You can get protein malabsorption. So you can be malnourished, right? Because your digestive system is not working right. Causes nutrient malabsorption. This can cause anemia. It can cause mineral malnutrition. So you're not feeling well, right? So this can also cause systemic inflammation, weight gain, chronic pain, insulin resistance, diabetes, upregulation of inflammation, decreased digestive system motility, intestinal inflammation, gut mucosal dysregulation. That's this right here. Right here, this is mucosal dysregulation. It started actually to degenerate. Your small intestines are actually starting to degenerate and rot away. We have poor fat absorption. Bile salts, right? You don't produce enough bile salts, which digests fat-soluble vitamins, vitamin A, D, E, and K, so you're malnourished in those. Damage to intestinal mucosa. You can see right here your nervous system, your enteric nervous system. That's just a nervous system. That's just the fancy name of your nervous system that goes to your intestinal system. It starts to degenerate and decay. So here's just a basic overview. Poor brain function, poor memory. You can't find words, difficult learning, fatigue. When this happens, guess what happens? You have decreased vagal output. So if you have decreased vagal output, that goes to your digestive system. You're not going to be moving correctly. Your digestive system is not going to be moving correctly. You're going to get impaired GI motility. You're going to get gallbladder contractions that aren't working. So you're going to get gallbladder stones. You're going to get intestinal disturbances. And inability to digest proteins, inability to digest starches, inability to digest fats. Intestinal permeability. So all this is coming from your brain, because your brain also, this is a vagus nerve, also goes down and talks to your nervous system down here, your digestive system. Here's a couple studies on rats. What they've done is they've caused these rats traumatic brain injury. So what they've done is, this is the small intestine right here. This is 1 cell thick. So what they've done is they've caused dramatic brain injury on these rats here, or these mice, I would guess you would say. And you can see after 72 hours, you see what's happening to their digestive system. It's starting to break away. It's starting to get leaky gut. This is after 72 hours. Then after 7 days, look at this. It's all broken up. The digestive system is not well at all. It's letting bacteria into your blood. It's causing inflammation. It's causing bacteria to get in your nervous system and go up into your brain and cause inflammation. So this is not traumatic brain injury, but if you've had concussions, if you've fallen, if you have brain fog, if your brain's just not doing well, it can't communicate to your small intestine, and this starts to happen. It starts to break down and degenerate. Okay, so I hope you found value in that. And next we're going to go on to part 6.